Okay. And it's streaming.
All right, hello everyone. Thank you so much for joining us today. Today we're going to have our presentation by Dr. King. So feel free to take it away.
Oh, Dr. King, I think we're having a little trouble with the audio.
Can you hear me now?
Yep.
Sorry about that. Hi, everyone. I just said thanks for joining me this evening and spending some of your Wednesday night with me. And I hope that you get to learn a few things about my experience as a pre-dental student, going through dental school, and then now, of course, in practice. But I start with this slide because I actually work in a Pacific Dental Services supported practice now. I'm an owner, and they help support me in that. So they're going to come up later in the lecture. This is my office name. The office I work for is Cottonwood Smiles Dentistry. It's in Albuquerque, New Mexico, and my Instagram handle is there. You can reach me there. I'll give you my cell phone number at the end of the slideshow, my email address, the address of my practice. You guys can reach out to me anytime with any questions whatsoever. Please, if it's pre-dental related, applying to dental school, looking for a job as a dentist, let me know. So this is a photo of my backyard here in Albuquerque. I show it because one of the focuses of my talk with you tonight is going to be about my why. And right now, as a dentist, my why is very different. Why I do what I do, why I get up in the morning, why I'm lecturing tonight, why I love teaching my associate dentist who just recently graduated from dental school, why I take care of my patients the way I do. But my why has changed throughout this entire journey. And so this is part of my why now. It was really important for me to come back home. I'm originally from Santa Fe, New Mexico. It's about an hour north of where I live now. I love the weather. I love the people. I love the food. I love the ability to travel really easily. And I love sitting in my backyard enjoying this view. So this is part of my why. And now I want you guys to think about your why. So we all ask ourselves this question. And I will tell you right now, if it doesn't come up in an interview, when you get your interview, I would be very surprised. Almost all of us will be asked this at one point or another, whether it's from friends when you're getting ready to apply, like, why would you want to spend the rest of your life in somebody else's mouth? Or, I can't imagine doing that. Like, what made you want to be a dentist? So really think about this, because I feel like our kind of fallback is we want to help people, but why? How do you want to help people? What does that involve? If that's your why. One of my whys when I first started thinking about becoming a dentist was that I love being involved in every part of solving a problem. I love figuring out what the problem is. I love coming up with a solution, and I love carrying out that solution. And it was hard for me to come up with that initially when I was first thinking about this question, so you want to be a dentist? Because when I decided I want to be a dentist, I was 13. My general dentist happened to ask me in the chair during my routine dental exam, hey, Marisol, what do you want to be when you grow up? And I don't know many 13-year-olds that know. Maybe a lot of you did. But I thought, well, I'm going to go into medicine. I'm going to be a doctor because I thought there was notoriety behind that. I could help people. And I thought I could make a good income. I think that's important. There should be no shame in thinking about that. So she brought up, well, have you ever thought about being a dentist? And I didn't really know anything about dentistry apart from, like, you go to the dentist every 6 months, they check for cavities, they clean your teeth. I didn't really know a lot about it. I didn't have anybody in my family that were dentists or doctors, for that matter. So this question changed the entire course of my life. And she planted a seed, and she told me, well, dental school is very hard to get into, and most of us are very competitive, and they tell us that something is hard, and we're like, challenge accepted. And she said, you get to talk to people, see generations of people, from grandparents to their kids, to their kids' kids, geriatric patients. I have a 101-year-old patient now. I just finished telling the moderators that I saw a 2-year-old as my last patient of the day. I see infants now. I mean, this question, or when she told me this, my general dentist, when she said I could see generations of patients, I love talking. I love talking to people. I'm like, I could talk to people and meet new people all day. Sign me up. And then she told me about the problem-solving portion. She told me about how hands-on it was, how we get to immediately get people out of pain. I mean, it's a surgical skill. I was sold. The next day, I bought my first set of scrubs at Walmart, and I actually went and shadowed at her office, and that was my first experience. So now you've decided you want to be a dentist. All right. So what makes a strong candidate? I know that a lot of you, this is strong on your mind right now. So let me be very matter of fact with you. You are going to be applying with the best of the best of the best. Dental school is very competitive. There are much fewer dental schools than there are medical schools. There are thousands of candidates for very few spots. And if this makes your heart race a little bit, don't worry. It made mine race too. But it's important to have a high GPA. It's important to have high DAT scores. You need to work on both, especially your science GPA, and especially the perceptual ability portion and reading of the DAT. I'd say overall, those two scores, dental schools pay attention to the most. But your overall application and how you present yourself on paper in your personal statement, that is so important. Because if everyone has good grades, and some universities now I know are pass-fail, and everyone has a good DAT score, a competitive DAT score, how do you set yourself apart? So what makes you stand out? This is your, I'm going to bring up these three words, your vision, who you are, what you want, where you want to go to dental school, your brand. This is like when we see a Nike swoop, we know that's Nike. Whether you have a good or a bad perception of them, you have a perception. So your brand is what people think when they see your name on paper, when they see you. And then I want you to also think about your personal value proposition. This was like a tough one for me to think about when I first was applying. What makes you different? So I think about sitting on the board, on a board for admissions, and I've been a part of an admissions committee now, which is very interesting to be on the other side and see what they're thinking about and what they're looking for. But the first couple of lines of a personal statement can really make you stand out. We also want to see someone who likes things besides just dentistry. Like, what kind of groups what kind of groups were you a part of in college and university? What did you do in your free time? Did you like working on cars? Did you work in a nail salon? Do you change your own tires? Do you drive a standard vehicle? Do you like to travel? Do you speak other languages? I mean, there are so many things about you that will make you unique, and that's so important in dentistry because we meet different people every single day. How are we approachable? How are patients going to see us? They're thinking about that when you apply to dental school. What's going to make you the best dentist and the best candidate for them to accept into school and to have success through those 4 years? Because it's very challenging. So think about what sets you apart. That's the most important. Really build your vision statement, build your brand, build that value proposition, that personal value proposition, and write a very strong personal statement. Catch us in the first couple of lines, and think about what makes you you. Besides the fact that you want to be a dentist. Everybody wants to be a dentist when they're applying. But what makes you you? So I was very, very blessed to get into the University of Colorado School of Dental Medicine. It's in Aurora, Colorado. Again, I told you I'm from New Mexico, and at the time, this was the closest dental school to home. Now, I put all my eggs in one basket the first year I applied. I did take a gap year. I spent 5 years in undergrad. I changed my major quite a few times, but I ended up with a major in chemistry and music in vocal performance, because I liked both people. I wanted to spend time with my science people, and I wanted to spend time with my music people. Like, I loved it. It balanced me out. And then I needed a break. So I took a break after dental school, and I worked as a dental assistant in a pediatric dental office. And now I'm really lucky. I get to call her my really close personal friend, and she refers patients to me. I refer patients to her. It's amazing how those bridges that you build can help support you after you're done. So I applied to 15 schools. New Mexico participates in the Western Interstate Commission for Higher Education, otherwise known as WICHE, because we don't have a state dental program. So the state has certain spots available to dental students, pre-dental students, that if you get accepted into state schools in neighboring states that participate in this program, you get partial tuition. So if you don't know about programs like these, please look into them. And the University of Colorado participated in that WICHE program. So if I was accepted into New Mexico's program and into the University of Colorado or a participating school, they paid for part of my tuition. So of the 16 schools I applied to, I got an interview at 5. So, and many of you will apply to more schools. Many of you will apply to less. Some of you will get more interviews, and some of you will get less. All you need is one acceptance. That's it. You need one acceptance. The degree is the same no matter where you go. It's what you do in the 4 years in that school that counts. Dental schools still aren't ranked, and we all graduate with the same degree, whether it's DDS or DMD. So remember that. Don't be disappointed if you don't get into your first choice. It wasn't meant to be. You were meant to be somewhere else, and that's okay too. I also want to say that while I was fortunate enough to get accepted into dental school in my first application, there were many, many students in my class that had applied more than once. I would say that in my class, we were the last class size of 52 in Colorado, and probably 50% had applied more than once. And you'd say, like, wow, like, what does that say about acceptance, about the kind of students that they're looking for? Well, sometimes that is what separates you. Sometimes it is that you are competitive, but not well-rounded. Sometimes grades are great, but you haven't really invested into figuring out what dental school is. Sometimes you had a great interview, but there was something missing. Like, you just never know. But I would say there was probably about 50% that had applied more than once. And my close friend from dental school, he applied 6 times. And I know some of you are like, why didn't he give up? Or maybe some of you are like, oh, thank goodness, it's good to hear that. Like, that was his story. So you gotta figure out your own. So again, I was lucky enough to get into the University of Colorado. I was a class of, I graduated in 2014, started school in 2010. And now I'm gonna tell you about what it was like. So ironically, this picture on the left, that little symbol there and the letters "We Serve," that was a lecture by a Pacific Dental Services supported dentist, like I am, my very last week in school. And I really didn't know what, I initially thought I was going to specialize, many people do, but I happened to meet my husband, my now husband in school, who is also a general dentist, and that changed things a little bit for me. And I'm so happy because I was meant to be a general dentist. I love everything about it. But this was interesting. I look back at these photos and things like, oh, there was a sign that was the direction I was going to go. The middle photo is me with the very last patient I ever saw in dental school, the very last day of clinic. And the photo to her right, to the right, those are her teeth. And that was my senior fix. It was a 6-unit prosthetic, an implant bridge on 4 implants. I was also very lucky that the University of Colorado doesn't have many specialty programs. And so we had experiences in clinic that many dental students do not. And I know this is still true because the specialty programs there haven't changed. So I had tremendous amount of experience in extractions, in surgery, implants, in implant dentistry, and removable. I mean, that was really important for me. And again, I was blessed to get into my first choice. One of the things I looked at when I was applying to school and how I kind of ranked what was important to me was, when do I get into clinic? How much hands-on experience am I going to get? Because I thought, for me personally, that was the most important, that direct care of patients, that skill of communication, of learning how to talk to patients, how to diagnose, how to treatment plan. I wanted a lot of that experience. And didactic, of course, was important to me because I wanted to do well on board. After the first year of dental school at the University of Colorado, you take the first part of your licensing exam. That's very different to other programs that might wait. We also went to school year-round. There are no breaks, so it's 4 years year-round. And we took finals, summer finals, the week after we took our licensing exam. So when I tell you it was tough, some of you are, it's going to be cake for you. For me, it was not cake. Dental school is very, very challenging. So, best day of my life when I graduated from dental school. That's me on the left, and I was actually hooded by the tall, good-looking guy is my husband. He graduated the year ahead of me, and the woman with her head turned that's a little bit shorter, that is the pediatric dentist that I shadowed during my gap year, who is now my close personal friend. So now a different set of stress comes after graduation. Number one, many of you will be worried about paying off your student loans, which are exorbitant. 2, you will be hoping to find the best job possible. Many of you will find the first and last job you ever have, and more of you will find the first of several jobs you have. So my husband was practicing in Arizona, and that's where I headed after I graduated. And that leads me to my very first job in private practice with Dr. Angel at Angel Dentistry. And this is a little cup that a specialist gave us. I still have this cup. I often think about this first job. So I didn't really know what I wanted in a first job, apart from I really wanted to start paying off debt. I took out student loans to pay for dental school on my own individually. I did not have anybody help pay off school, and I came into dental school debt-free. I did not have any undergraduate loans or graduate loans. So my focus was on getting a paycheck, but I also really wanted to learn. And they give you some recommendations on how to find a job, what to look for in a job. It's all kind of hypothetical unless you jump in or you talk to someone who's already done it, which in my case, I have my husband who gave me a little bit of advice, but we're 2 different people, so looking for 2 different things. So Dr. Angel, I was her very first associate dentist. She'd never had one before. I didn't sign a contract when I took this job. It was a handshake agreement. And I am so thankful that she is just a wonderful, wonderful person who really supported me, and that worked in my favor. But I would strongly encourage you all to not take a job without a contract. It's not a good idea. You probably won't be as lucky as I was. I was very lucky. So in that first year, I learned a lot because Dr. Angel actually went on maternity leave a few weeks into me starting my very first job. This practice had been there for 10 years. They'd all of the patients had only ever seen her. And so for a new dentist to come in, it was very different for them, and it was very different for me. And it was a kind of a sink or swim because I had to handle many patients, many different types of things, learn more about diagnosis in a very short amount of time. And it was wonderful for me. I like working independently. I love having help when I need it and when I want to ask for it. but I really like to work independently, so this was wonderful. So this wasn't my last position. I already told you I'm in New Mexico. This practice was in Arizona. My husband had an opportunity to work in public health. And so after this first year, I let Dr. Angel know that we were going to move to a really small town. And in a tiny area in northern Arizona called Cottonwood. It was a town of 12,000 people. And that leads me into my second job after this first year. That first year was wonderful. So I'm going to show you, this is the very first set of veneers I ever did. I want to give you another piece of advice. Again, I told you that my why I do what I do, why I love doing what I do, why I get up in the morning. I started to figure that out. I take photos. So my advice is take photos, as many photos as you can. Don't worry if they're great. Like, look at that top left photo, it's grainy, like your iPhone could take better photos now. Like, take photos of everything you do. This is how you will learn, this is how you will get better. It's wonderful to have them. It's exciting to look back and say, like, what did I do? How could I do this better? So this person was very embarrassed about the unevenness of her smile, the discoloration. So we did 4 veneers. Veneers are like porcelain masks for your teeth on the 4 front teeth. And this was my very first case. It was so exciting to do this from start to finish. And to think back, I obviously have some geographic success, meaning I moved, so I have no idea what happened. But I'd like to think that she gets to smile with all of her veneers, all of my veneers still in her mouth. And this was back in 2014. All right, so this is my second job. So this was my first experience with a dental service organization. We call them DSOs. And that was with Pacific Dental Services. And I don't know if any of you have heard of this or heard people talk about it, know dentists that practice in this model. But essentially, it's private practice. So that means we are fee-for-service practices. I'm not in public health. I'm not in a nonprofit. I see patients with insurance. I see patients without insurance. And these practices are privately owned, independently owned by dentists. So my autonomy is preserved. That means my ability to choose what I do, how I do it, who I hire, what equipment I use. That's all my own. But I partner with Pacific Dental Services, which is one of the largest dental organizations in the world. And they help me with billing, with HR, human resources, with finding good candidates for positions, helping me recruit dentists, helping me with financing equipment. It's just a wonderful, wonderful, wonderful partnership. And this was my first experience in it. And I have to say, I met it with some trepidation. I was a little bit concerned because I wasn't sure if someone was going to tell me how to do what I wanted to do or tell me that I had to do it a certain way, and that couldn't have been further from the truth. So Cottonwood Modern Dentistry was my second job in that tiny little town of 12,000, and this is when my life changed because I was introduced to these 2 machines. On the left is a Xeric Omnicam, and on the right is a Schick intraoral camera. I'm a digital dentist. Everything I do is digital. I have incredible equipment in my office right now. My background before I got into dentistry was actually as a graphic designer. I freelance graphic design. I did graphic design in undergraduate. I still do some for friends and family, but this changed the game. It was so fantastic to be able to solve problems in one day. So if a patient came in with a broken tooth, I had this tool to take a photo, show them the broken tooth, show them where the cavity was. Now patients get involved in their own care. I get to show them what the problem is, and it's so much easier to come up with a solution together with the patient when they know what the problem is versus telling them, like, yeah, this tooth is broken, you gotta trust me on it, this is how we fix it. And you can do that, it's only gonna get you so far, but trust is so important. Trust between myself and my patients is so important. So that little intraoral camera helped me do that, and then the left help me come up with a problem, help me come up with a solution to the problem. All right, so go back to my why. The satisfaction of fixing a problem is a huge part of my why now. I told you I thought about that when I applied to dental school. I love fixing problems. I was the girl who drove a standard vehicle. I love doing nails. I wanted to work in a nail salon. I changed my own tires. I changed my own oil. And you better believe I wrote that in my personal statement. Absolutely, that's a part of who I am. I'm a graphic designer. I love all things digital art. The satisfaction, I was a chemistry major, like chemistry just made the world make sense. The satisfaction of finding a solution, regardless of the path you take to get there, is wonderful. Like that there's an answer. In dentistry, there's many answers, but there's an answer. And that piece of equipment on the left, the spheric Omnicam, which many of you will have the opportunity to play with and use in dental school, oh, it's just amazing. It changed my life. So now we're going to go on to the second set of veneers I did. So now you're noticing like my photos are getting a little better, the contours are getting a little better, but this set is very different because I actually made these myself. So this was the first opportunity to fix someone's smile from start to finish all by myself. And I use that machine. So this patient shared with me that she was so embarrassed. She'd always been embarrassed for her smile. She felt like it made her look so old, that her teeth were yellow, they were discolored, they were uneven. And so I had the opportunity to let her know I can fix this in a few days versus a few weeks by sending them out to a lab. I have to take good records. I want you to talk to me about what you want. And that's what we did. So from start to finish, I got to do this myself. There was no greater satisfaction. I was sold. I never wanted to practice different dentistry, anything but digital dentistry ever again. So I got also, practicing in this small town, I got to see things that I otherwise wouldn't have seen when I first started practicing in Phoenix, in the Scottsdale area. And now in Albuquerque, my practice situation is just very different. In a town of 12,000, there were 8 dentists. 8. My husband and I were 2 of them. The closest specialist was 90 miles away. I mean, we saw everything. So this gentleman walked in, and you see this kind of pimple-looking thing underneath his chin. That's actually an abscess that drained through the bone, through the soft tissue, through the musculature, and out the side of his face. And he noticed that he had a broken tooth and that he'd have some pain occasionally, but that pain would go away if the pimple on the bottom of his face popped, because all the pus was draining out the bottom of his face. I mean, unbelievable things. So for this gentleman, we not only extracted the tooth, of course, but we actually had to make an extra oral incision underneath his face to get that to drain, to clear out all the infection. And I actually saw him years later, and he's doing great. We still talk about that story, ironically, after my move to New Mexico. So again, I got to continue to do things in the office, solve problems in the office. I learned the things that I liked to do. I learned the things I didn't like to do. So I always tell people I'm a general dentist. I can do generally everything. That means that I'm not limited by just doing fillings, just doing crowns. I do dentures. I place implants. I do full mouth reconstruction on implants. I do veneers in office. I do lip ties and tongue ties for infants, for brand new babies, just a few days old. I mean, I'm only limited by what I want to do. As long as I practice it to the same standard as a specialist, I can do pretty much anything. So this patient really didn't like her spaces. She didn't like those gaps. So we were able to fix that, by doing 4 veneers. And you notice again, like my photos are getting better. my dentistry is getting better. I'm a few years in. Take photos of what you do. This was another great case that I got to do in Arizona. This gentleman was 19 years old, and I want you to notice that his gums actually look really healthy. Overall, his gums look pretty healthy. So he came in and he said, I just wasn't in a position where I could afford to go to the dentist. I was making the wrong decisions in my life, but I want to get a good job. I want to apply to, he wanted to be a master mechanic, and he'd gone to school for it, and there was a position opening in that small town. He said, I'm just embarrassed that they won't hire me because of what my teeth look like, and he's 19. And so, I mean, we notice this, right? There's that meme that goes around with the guy's like missing an eyebrow and also missing a tooth, and all you notice is the missing tooth, not the missing eyebrow. Like, we notice these things. So we were able to do this in one day for him. We fixed the cavities, we crowned certain teeth, and it's a completely different smile, completely different. So after this visit, 2 weeks later, he came back for his follow-up care, for his checkup to make sure everything was feeling well, and he said it applied to the job and gotten the job, and he had a date that night, which was, I'll never forget this. You will have situations like this. You will change the trajectory of someone's life. To have the power to do that is so exciting. It's so exciting. So that year was wonderful. It was eye-opening. It was so incredible that my husband, who was in public health at the time, would hear me come home and say, like, I got to do this today. I got to do this. I learned this. I did this. I trained in this, because Specific Dental Services offered me the opportunity to meet other dentists that were supported by them, that were interested in the same things I was. I could pick up the phone, call someone for help. They sent me to California to train on this, to learn more about patient communication, to learn more about treatment planning. So my husband's like, I want to do that too. Like, I love that. I want to do that too. So now comes the third position, and this is my current office, Cottonwood Smile Dentistry. I started in Cottonwood Modern Dentistry. The irony does not escape me. I do not know how that happened. To now practice in Cottonwood Smile Dentistry. And my husband also became a Pacific Dental Services supported dentist as well. So we actually own 2 dental offices. We work in 2 separate practices. People ask us all the time, like, why don't you work together? Well, first of all, I love being happily married, number 1. And number 2, we corner the market. We live right in the middle of both of our offices. And all of the patients in our community go to either he or I. We share equipment. We share team members. We help one another. I mean, it's just like a wonderful, wonderful, wonderful thing. So this is my office, Cottonwood Smiles. I started as an associate, and now my why changed. So I'm learning more. I'm in my 3rd year of practice. I'm more experienced. And I realized that I love teaching. Like, I absolutely love it. I love showing people what I do. There's very few months where you won't find a pre-dental student, whether they're in high school, in college, or sometimes I have like brand new dental students for a 2nd year come in and shadow me, because I'm not going to take this information with me when I die. Like, I want to share it with as many people as I can. And I didn't have that same experience. When I started, Dr. Angel, after she went on maternity leave, I was kind of by myself. When I went to Cottonwood Modern Dentistry, there was a dentist that was about the same age as me, a little less experienced. So we kind of were helping one another out, but I didn't really have someone showing me. So once I joined this practice, I realized, like, I want to be the person. I want to be the dentist that other dentists want to come and learn from. I want to teach dentistry. So that became my why. And being with Pacific Dental Services, there was lots of opportunities to teach. So I started doing that. So I want to introduce you to some of the people also that complete my why. On the left, I have an expanded functions dental auxiliary in my office. That means that she can do fillings, cement crowns, take final impressions. She can do just about everything except for drill into a tooth and pull it out. She is a tremendous help, and she started with me about 4 years ago as a dental assistant. And after the closure in 2020, my office was closed to emergency dental care only. We were slammed. We were really struggling to keep up with patient flow when we reopened. And so I hired her husband, who is giving the thumbs up like this, and he is my instrument technician. In the middle, the tall guy patting my lead dental assistant, he started with me my very first year in Cottonwood Smiles Dentistry. He was my lead dental assistant, and now AJ is in hygiene school. He's in school to be a hygienist, and when he graduates, I will hire him back, and he will work for me again. And then on the right side, that's Dr. Kim, Dr. Melanie Kim. She graduated last year in June from Loma Linda, and I am teaching her everything and anything I know, and she is my fourth associate, not because we had there was any bad blood between the associates I had in my practice. It's that they grew and wanted opportunities to own themselves. Some of them moved. One of them now works permanently with my husband. So it's been wonderful. It's been wonderful. And Dr. Kim has been my best associate thus far. I hope that she will join my practice as a partner in the future. In the left side, that's my front office. Sandra, Jesse, and Jacob. Right in the middle, that's Jennifer, my hygienist. And on the far right, that's Sarah, my lead hygienist. They are another reason for my why. They are so important to me. They help me do everything I do. They keep me honest. We all work collaboratively as a team. I can't do my job without them. I respect them, and many of them have been now with me for years since I've been in this practice. So they're really important to who I am and what I do as a dentist. AJ, my lead dental assistant at the time, the one right in the center there, patting Cassandra, he drew this sign for me on my window when we closed for the 3 months that we were required to, and it was very, very, very challenging. I know I'm really glad for those of you that are pre-dental that you won't have to experience that. I know it's very challenging for dental students too. Boy, you never anticipate things like that happening, and without them, I couldn't have gotten through that time. I'm going to show you another case that I did. These are actually prepless veneers. That means that there was no drilling done to these teeth. I carefully removed her old veneers that were also prepless. She was unhappy because she said they looked short, and she doesn't show any of her lower teeth when she smiles. She only shows her upper teeth, and she felt like they were discolored and chipped and kind of uneven. So I carefully took off her old veneers. There was, there was 8 veneers that we did, and I did prepless, where I just took a digital model of her teeth, and my laboratory technician designed these. I did not do these in-house. So there's still, I still use my lab. I had a wonderful laboratory technician that helps me with cases. So I just want to show you her before and after of her smile, and you can just see how a smile can completely transform someone's face. Absolutely amazing. And again, photos are getting better. Dentistry is getting better. Take photos of everything. Here's another case. It doesn't always have to be veneers. These are just some of the fun things that I get to do during the day. This person had braces, and they ended up with white decalcification on their teeth. It's white spotting on their teeth around the brackets. They can be the beginning of cavities. And she was really unhappy with how the previous dentist had filled them. She felt like you could see all the edges of the fillings. They didn't blend well. Her teeth were discolored. So here we were very conservative. We just replaced the fillings, and I blended them into her teeth better. So now she smiles so confidently because you can't see any of the dentistry. I think some of the best dentistry I do is the dentistry patients don't remember and they don't see. That's some of the best dentistry. This person hated their diastema, the space between their teeth. They felt their teeth were discolored. They said that they'd always lacked confidence. This is how they personally felt, right? It doesn't mean that this is how I felt, but because they thought that people judged them because they had a space between their teeth. So this is a case I got to fix in the office in one visit, start to finish. He came in, we got his teeth ready for veneers. We put four porcelain veneers, and I want to show you his smile. So you're seeing close-up, but what most people see is this. This, to me, is another why. I told you, changing the trajectory of someone's life. You could almost describe the left side as goofy, right? Like maybe it's a little bit of a goofy smile, because I think that's probably what he thought people thought of him. So that's kind of how he acted. That's kind of how he was. On the right side, I had just delivered the veneers, and the only thing I asked him to do was smile. And he'd already looked in the mirror, and that right photo, the first thought that comes to mind is confidence. So much more confident. So it's just incredible the things that you can do. This gentleman came to me, and there was really nothing we could do to save his upper teeth. He was a great implant candidate. So we rebuilt his entire smile on 4 implants, and we did an implant bridge. Even though you can't really see his teeth a whole lot, by replacing them, even with a low lip line, you change someone's face entirely. So he has teeth that are completely fixed on implants. And that's just another part of my why. I love learning new things. Like, it's just fantastic to have this another way to fix people's teeth and give them the ability to chew, smile, be healthy again. And then this is one of my favorite cases. So this beautiful, beautiful woman, she was having really challenging issues with sinus pressure. She was having sinus pain, frontal sinus headaches. She had a white blood cell count that just wasn't being stable. And finally, one of her doctors said, like, have you gone to the dentist recently? This might be related to your dental health. We're not just tooth doctors. I love fixing teeth and I love fixing smiles, but at the end of the day, the mouth is connected to the body. There is a tremendous connection. We deal with systemic health all day, every day. What goes in spreads throughout. So this is where she started. She had advanced periodontal disease, which is an infection that not only affects your gums, but it affects the jawbone that holds your teeth in place. She had bacteria traveling through her bloodstream. It was affecting her sinuses. She had many abscesses, which were negatively affecting her white blood cell count. So in this case, we had to take out all of her teeth. We rebuilt her entire mouth on implants with implant bridges, and this is where she finished. I'm going to go back so you can see the before. You can look at her jawline, the just the color of her skin, that she almost looked swollen, and how she looks now. We probably added years to her life. So, I'm going to leave you with this. How do you want to practice? And this applies to dental school. You want to think about where you want to go, why you want to go. That's your vision. What do you want to do when you're there? Where do you want to go? How are you going to get there? Your vision. Create that personal vision. Second, your brand. Nike Swoop. Doesn't matter if you think positively or negatively about it. What do people think when they see you? When they see your name? What's your why? And then lastly, your personal value proposition. This is what makes you different. This is going to have applications to your dental school admission, to getting your first job, and to figuring out what you want to do for the rest of your career. This is like your 30-second elevator pitch. I want you to think about those 3 things. And I want to thank you guys so much for letting me spend this evening with you, and I want to give you some time to ask me questions about dental school applications, if you want to ask me questions about being a dentist, if you want to come and visit me. You can visit me anytime. Oh, I apologize. I thought I had put my phone number on there. If you guys have a pen or a paper, you have your cell phones nearby, my cell phone number is 720-515-5510. 720-515-5510. It's really easy to reach me on Instagram. I check it regularly. You can send me a message. You can email me. You can Google Maps, Apple Maps, my practice. If you want to get on a plane and come hang out in my office, do it. I'd love to show you around. I'd love to show you why I love what I do. Like, I think this is the greatest profession. I can't imagine doing anything else. I love what I do. I love coming to work. Every day is a challenge. It's always different. And I hope you get to enjoy it as much as I do. So, any questions?
All right, thank you so much. That was all super informative. So we have some questions. So I guess we can start from just like the beginning of your dental journey. So while you were in undergrad, what type of extracurriculars were you mainly involved in? Was it like mainly science-based or like also like non-science-based?
All right, so that's an awesome question. I was in a sorority, and that was a huge opportunity for me to meet people from all different backgrounds, and it was a huge resume builder. I went to the University of New Mexico for undergraduate here in Albuquerque. It's a non-traditional university, which means that a lot of the students commute. Not a lot of people live on campus. There's 40,000 students, 40,000. So setting yourself apart and being unique is very challenging, and Greek life was the best way for me to do that. So we were involved in community events, in helping with the Ronald McDonald House, in setting up the homecoming events, in just pretty much anything that happened on campus. I also was, I told you music was my other degree. So I was part of the choir at the university, the concert choir. I love to travel. I'm half Guatemalan and half Irish. I think it's just in my blood. So I speak Spanish as well, which was really important for me to put on my application, and I use it every day in practice. I made sure to spend time in more than one dental office. So I had the opportunity, I told you, to work in a pediatric dental office, but I spent time with an oral surgeon, I spent time with an orthodontist, I spent time in multiple general dental offices, and I studied a ton on top of all of that. And I told you what really separated me was all the other things like graphic design. And I worked like 3 jobs while doing undergrad. Those are the things that I did apart from loving dentistry.
Awesome. And then you also were talking about the DAT. So do you have any advice for people who are going to take the DAT? Are there any study materials you use or that you think were most beneficial for you?
Yeah, so I took a course, at the time it was hosted by Kaplan. I took a Kaplan DAT course, but the thing that helped me the most was practice tests. Like, in general, guys, standardized tests, test how well you can take tests. That's it. It's not about how smart you are. It's not about how your ability to do well in life. I have a little book here. It's the dental drug booklet. It's this thick. I use this every day. I didn't have to memorize all of my pharmacology because, information is at our fingertips. So you need to be a good test taker, though. This is problem-solving skills. It's important. So I took the Kaplan course, but I took tons of practice tests. You need to hone up on your reading and writing skills. This is so vitally important. Grammar, punctuation, being able to have a start and an end, concisely put ideas together. These are the things that matter in dentistry. These are the things that an admissions committee will look at, and your ability to perceive 3D objects in 2D space that's what the perceptual ability test is. If you can do things like change your tires and do nails and do your hair in a mirror and I don't know, drive a standard vehicle, like those are things you practice every day. You just don't realize you do them. Do well on the PAT too.
Okay.
Practice test, practice test, practice test. Sorry.
Yes, exactly. And then what was your transition like from undergrad to dental school? Did you find it to be an easier transition, or was it kind of difficult? Was it very different?
Yeah, it was very different because I felt like an undergraduate. I had a semester where I took 23 credit hours. It was outrageous. I to this day don't know how I got that through that semester. It was just what I needed to do to graduate. But I would say that dental school, each semester of dental school was like that 23 credit hour semester. There are more exams than you have time to study for. And again, some of you will find it easy. That's the reality of the situation, especially the didactic portion, the book learning. And some of you will find it very challenging like I did. Like I really had to study a lot, and I didn't feel like there were enough hours in the day to study for the number of exams we had. But what I lived for was clinics. So at the University of Colorado, we start clinics our second year, and I powered through the first 2 years of school. It was a lot like undergrad, right? You have to study hard if you want to do well. If you're thinking about specializing, doing well in school is important. There are opportunities for extracurriculars if you want to specialize. Setting yourself apart from your peers is still important. But I had a lot of fun in dental school. So I mean, I met my husband. Like clearly, I had some fun. But it was similar in that I had to study a lot. There just wasn't enough hours in the day. But then what was different was that you had clinics where you started to use your hands. And while I had some labs in undergraduate and there were opportunities to use my hands, it was so different, right? Like this is solving problems with your hands. And that's where I really excelled. I love clinics.
Oh, thank you. And related to shadowing, what do you think is the best way to contact the dentist to ask them for shadowing? Do you recommend going in person, asking them by calling or through an email? And then what generally should they ask?
Okay, great question. So most of us are super approachable and we want to share our profession and why we love doing what we do. So if you do a quick Google search and you look for dentists around where you live, that's a great place to start. And then shoot them an email or call the office. If you call the office, sometimes you get the front office and the message might be delayed getting to the dentist. So email is a good way to do that. A lot of us have Instagram, have social media accounts. Like if you find us on Instagram, send us a message and then tell us what you're interested in. Like I'm in my second year of undergraduate. I'm interested in being a general dentist, or I'm interested in being an orthodontist. I'd love to spend a day with you or a few hours, or I'd love to ask you some questions. This is my cell phone number. This is my email address. If you have a chance, if you could reach out to me, I'd really appreciate it. That's as easy as that. Don't be worried. Don't worry. Like every single one of us started where you did. Every single one. There are no exceptions to this. We all had to go through dental school to do what we're doing now. So we all start somewhere. And that's it. Do a Google Map search, find the dentist closest to you, reach out to us. And also you can do this virtual learning too. Like you don't live in New Mexico, you're nowhere close to New Mexico, you're not going to hop on a flight. Great, send me a message. I'll turn my FaceTime on. We'll FaceTime around my office. I don't care.
Okay, cool. And then again, with shadowing, when a person does have shadowing in person, what do you recommend they do? Should they ask a lot of questions to the dentist? Should they be writing information down? What do you generally think that flow is like?
There's always a little bit of anxiety, right? Like meeting a dentist and like, I don't know, we're intimidating. I don't know how that happens, but we are. We're like a little bit intimidating. So I go back to what I just told you. We all start in the same place. If you have questions that you want to ask, genuine questions, ask them. If you have no questions and you just want to watch what we're doing, great. When someone comes to my office, I always tell them, there's no obligation to stay for 8 hours. My day could be super exciting where I do tons of different things, work can be really boring. I mean, not necessarily boring for me, but like if you're not sitting in the dentist chair and you're just kind of walking around, like there's all different things that happen every single day. So feel free to stay for an hour, stay for 4 hours, stay for the whole day. I don't care. And most dentists will feel the same way. I'd say 2 questions to ask would be, would you like me to wear a mask and gloves when I go into a room? And because that's kind of a little bit awkward, like, well, if the dentist is changing their mask, and should I do that? Like, then then it's no problem. I would say if there's anything you want to tell me while you're doing these procedures, like, I'd love to hear what you're doing. That's great. Then you let the dentist they have the opportunity to tell you whatever they want. And if you have a question about a procedure, ask. Yeah. But you don't have to feel, it's so intimidating. It really is. Like, you don't have to feel like, oh God, I need all these questions. Like, we're nervous too. We want to make a good impression. So we're going to ask you at the end of the day, like, what questions do you have for me? Do you have any questions? Like, it's kind of our go-to, right? Like, for those of us that get nervous.
Great. And then related to your practice, are there any procedures that are your favorite to work on?
I love crowns. We call that bread and butter. That means that's pretty much what I make my income on. But the feeling you get when a patient comes in with a broken tooth that you can just fix in an hour, and it's beautiful and well-healed, and it's everything you did from start to finish. Like, I love that satisfaction. I love placing implants. I love surgery. I love taking teeth out. I love blood, gut, gore. Like, I like that. I hate root canals. I hate them. I do maybe like 1 root canal a year for a family member that cons me into doing it. Like, that's not, I don't want to do them. My husband, on the other hand, loves root canals. Loves them. Does them every day. Loves them. Probably does them as well as the specialist. But he does do them as well as the specialist. I did not want to be a pediatric dentist, but I do like seeing kids in my practice. So I think that's fun, knowing that they are going to remember something that I said to them for the rest of their life, like that you have that kind of power, the way I remembered what someone said to me for the rest of my life, and that's why I'm a dentist. That's really exciting.
All right. Well, I think that's all the time we have for questions. But again, I want to thank you so much for presenting for us and answering all the questions, all super helpful and informative. So yeah, thank you again. And I hope everyone has a good day, and thank you for joining us.
Absolutely. Good luck.